Hi, we're going to see a complete hair transplant procedure today. So you're at Tamira with me, Dr. Jayanti, and the team. So we'll take you through the entire steps of hair transplant procedure. I'm sure you'll have gone through many videos where you've seen various procedures. I would like you all to see how is it done differently at Tamira. Tamira is an NABH accredited single specialty hospital. What it means is National Accreditation Board for Hospital has accredited this hospital to be safe with all ICU backup, ventilators for any procedures. I'm sure you've heard of many complications in this procedures done outside, and today we'll take you through every steps and you could see the safety parameters that's in place where you can get your hair transplant done. The entire team which operates on you are board certified plastic surgeons, no technicians here, and that's a difference, and I will tell you the difference in every step. Come along with me. So I have explained to you, right? So the thing is your grade 7 baldness. So everybody's results differ from patient to patient. Why am I telling you this is look at the donor area, right? So this is the donor area. So we go through the donor area. So that's the donor area. You see how little donor area you have. And now we will manage taking whatever donor that's possible from your scalp, and we also will take grafts from your beard. Combined, put together, we thought we will try up to 3,500 grafts. I never said I can 3,000, but I will try as much as possible. With these put together, our goal is only to give you a hairline, right? We are not going to give you a scalp full of hair, which has already been discussed with you, right? With every patient, we discuss what is possible, right? So that is very important for you to understand. So I'm going to quickly draw your hairline so that we both agree, because we are going to have limited grafts. We don't want to do very low hairline, because many of them, when they have advanced grade of baldness, they want to do very low hairline, which will not look realistic. And the next thing is we are going to do FUE, right? So the reason why we don't do FUT is, imagine you have about 15 centimeters length here, right? So the length here you have 15 centimeters and not more than 5 centimeters breadth also you have. If I take off 2 centimeters, let's say 15 into 5, that is 150 squares. Out of that 150 squares, let's say I take 2 centimeters, so 15 into 2, 30 square centimeters. In that 30 square centimeters, let's say you have 70 follicles per square centimeters, right? So you are going to get only 2,100 grafts, correct? So 2,100 grafts, and probably even if you do some FUE along with that, you will not manage more than 1,000 grafts. But what are we doing eventually with that 3,500? We can't cover your entire scalp at any cost. But the surface area of the scalp, your scalp is fixed. And so what are we doing? We are expanding the remaining recipient area. So the area to be filled will become more. Okay, so let's start the procedure now. Before that, let me just quickly mark. Hold this, come and sit here. So I'm going to take a high hairline. I don't want to take a very low one because it's not going to... let's say this is your midline, right? Between your eyebrows, we'll take 8 centimeters from here. I will mark and show you. Tell me if that's okay with you, all right? So you have to tell me whether you're happy. Understand the rationale why I am taking this high hairline, okay? When it grows, don't imagine without growth, right? Imagine with growth, because as the hair grows, it will come down. Hair is a length, right? It's not a point. So imagine, so this is already, we have a length of about nearly 15, right? So even if it is 13, imagine I can cover only 5 or 6 centimeters at the max, right? The same, even if I have 3,000 grafts. So being able to cover at least this much to give the hairline, right? Our idea is to give you a thick central tuft and then a hairline, but we want to make sure that we cover this so that you have a proper hairline when seen from the front. So it doesn't look like you have some hair here and there. It looks like a proper hairline, and we will try to cover till here. Okay, give him the mirror. Have a look.
Similar to what we discussed last time.
Yeah, so that's why we will start from here. So we will cover all this area so that when you will have this hairline from when you see both sides, both here sides as well as the back. So we will pack this tightly So this is what is a tight packing. Then the remaining graft probably till here we'll be able to cover. That's all we'll be able to cover. Whole here we won't even touch, and it's, you do not have grafts. But from the front, if somebody sees, you will have hairline. That's what we are going to do. All right? Okay, good. Let's move. So please come along with me and you will see Tamira's infrastructure. So this is a full-fledged hospital. So you will see an ICU here. Our ICU is fully equipped, and I will show you inside. You can see the ICU. We have ICU fully equipped with ventilators and everything. You will see here in Tamira, the surgery is done in full operation theatre, laminar flow theatre. You please go. I'll just give local, get it ready. So in this patient, we are going to do both beard and scalp. So I'm going to give local anesthesia. What is the difference in doing hair transplant at Tamira versus any other place is that you have to see that this theatre is a full laminar floor modular theatre, and we have all backup. You have an anesthetist here. We do not do hair transplant without the presence of an anesthetist. You've seen many unforeseen complications, but here at Tamira, so the patient is being given sedation. So when you give sedation, patient goes into a deep sleep, and at that time when the injections, local anesthesia is given, they don't feel much of a pain. All of this effort is taken just for the comfort of the patient, so that patient does not feel the pain of local anesthesia. So we have all monitors in place and for all safety parameters, and hair transplant should be done in theatre, not just a clinic room where you don't have any safety parameters. It is very important that when you go for consultation for hair transplant, please ask where hair transplant is done. So there are only two steps in hair transplant. One is harvest of the graft, second is implantation, and time duration between these two should be as short as possible so that for the survival of the graft. So I'm going to start with the local. Can I start with the local now? Okay. You can see how comfortable the patient is when we are giving local. He hardly feels the pain, and we'll just quickly finish the block while he's sedated. And you can see the team around. Everybody, all sterile precautions are taken. We don't just wear only gloves and do the procedures. Many places it is done because think it's not necessary, but here all complete theatre protocols are followed. So when you go for hair transplant elsewhere, you can compare the difference between why it is done this way, and we don't want any infection. So all these safety protocols are taken only for the safety of the patient. So if you look at our theatre, we have also designed it in such a way that if the patient's attender would like to see the procedure, they can stand outside of this glass window and see the procedure as well. So we are as transparent as that. Not just that, when the patient is awake and we are implanting, patient will also can have a bit of relaxing, not claustrophobic. Okay, he's ready to be shifted. Chen. So in this patient, he's a grade 7 male pattern baldness. His donor area is very limited. Patient has been explained regarding the limitation of the result. That is, the total graft that can be harvested from the scalp will be around 2,250 or so, and then about another 1,000. So together between scalp and beard, we'll manage and take around 3,500 graft, and these grafts will be placed to restore hairline, and that's been explained to him. So every patient is different. You will be seeing many before and after on the digital media. Doesn't mean that everybody will get the same result. The area to be covered, the number of grafts that's available, and the way the grafts are harvested and implanted will decide your result. Most important is to keep in mind the safety parameters. Hair transplant is not just a parlor procedure where just in a small room it is harvested and surgeons flying in from somewhere coming in doing the procedure for you just that day. At Tamira, the entire team is here. We are a team of 4 plastic surgeons, and of course we have team across India. You can just visit our website www.tamiralife.com. You will see our surgeons, and then all of us here at Tamira, we work as a team. So in Tamira here in Chennai, the surgery is not done by any technician. The entire process is done by board certified plastic surgeons. So hair transplant involves two steps. One is harvesting and one is implanting. So you've heard of numerous terminologies. What is DHI, direct hair implant? So there are in DHI they use implanters, and harvest and implantation probably is done at the same time. But we want to avoid unnecessary graft handling. So grafts are first handled, they are all stored. You'll be able to see how they are stored. They are stored with platelet-rich plasma solutions, and then they are implanted. Then during implantation also, many of my patients have asked me, what technique do you do? So there are numerous blades or needles that are used to make pre-made slits. That is, the surgeon makes slits and then a technician or somebody implants the graft. But at Tamira, we do not do that. The entire implantation process is also done by plastic surgeons. So we do what is called a stick and place. So when we harvest, the grafts come out in different sizes. So you can have a single hair follicle unit or a 2 hair follicular unit or a 3 hair follicular unit. All of this vary in sizes. When you make pre-made slits, all slits are going to be of the same size, because if you use even size of different blades, you will not be able to identify which slit is of what size. So if you make which can accommodate a 3 hair unit follicle, which is bigger, but you put a single hair, there is a chance that it can fall. So hence we use what is called a stick and place technique, where we use needles of different thickness based on the size of your graft. Even a 2 hair follicle unit in some patients can differ from another, and hence accordingly we choose the size of the needle.
Okay, hi, I'm here to talk about the hair transplant and the anesthesia for it. I'm the senior anesthetist here, and we're a team of anesthetists who come here to manage all hair transplants and cosmetic surgeries. So for a hair transplant, what we do is we do the pre-anesthetic check first for every patient with all the investigations, routine investigations required, so that we can assess each patient properly and see that any condition they have, any comorbidity they have, is managed adequately before surgery. Once the entire workup is done and everything is managed, the required references are done, and the patient comes for the hair transplant fully fit. In the OT, the first thing we do is monitor the patient. We monitor all the vitals, the blood pressure, the heart rate, the saturation. Everything is monitored throughout the surgery, and we also see that sterility is maintained fully, and the conditions are absolutely amenable for the patient and for a clean, comfortable and successful surgery.
So every donor area is very different. If you actually can zoom at his donor area, you can see how thin the follicles are. So his follicles predominantly will be only singles and twos. So again, I will show you how at Tamira we have different punches which are chosen for different patients. The hair that is outside of your scalp does not have life. So when you go to a salon and cut your hair, you don't feel anything. So it doesn't have life. It is the tissue that's surrounding the hair inside the skin that produces the hair shaft. And we have to harvest that with carefully if the hair has to grow. That's the most important part. And so the instrument we use to harvest plays a very crucial role, as well as the surgeon skill also plays a very, very crucial role in that. So you can see throughout the process, monitoring is going on. We have an anesthetist here. A hair transplant is a very, very safe procedure. If you do it at the right place with the right surgeon, you should not have any complications at all. You can see the entire process is just done at the level of your skin and not anything beneath. And you can see how comfortable the patient is. So patient will be awake throughout. Once he's just sedated, he's not given a complete anesthesia. In half an hour he'll be awake once we finish all the block, and he will be able to talk to us and follow any instruction that we want him to do. Do you have pain?
Yeah, for 2 months. No, it's not.
Okay. Do you feel the prick?
Yeah.
Do you feel this prick?
Now it is not there, but before.
Before you had, of course, I'm giving. Yeah. So do you feel prick now?
No.
Okay. Do you feel prick now?
Nothing.
Okay. So when I'm giving the block in the initial, you will feel, right? Now do you feel?
Nothing.
Okay, very good. So it's already blocked now. Hereafter you won't feel anything. And I'm still giving some block to check all areas. Can you bend your head, please? Very good. No, you keep it comfortable. Go back. You keep it like this. Just adjust yourself at the back so that your neck is not floated. Keep this here. Go back on the bed. Yeah, that's fine. You're okay now?
Yes.
Perfect.